Should your child get the COVID vaccine? Well, this is a question by Scientific American. A pediatric infectious disease expert answers the question about whether the vaccine is safe and why your children need it. So they ask a question right off the bat, and they basically tell you their position immediately, why your children need it. Now, this is something that every parent wants to know. It's the million-dollar question. And one of the things that I thought of immediately when I first saw this article is that the head doctor in the unit that my daughter was born into, our firstborn child, one of the things he told me when I started asking a lot of questions of things I didn't particularly agree with that they were doing is he says, the only one responsible for your child's health is you, the parent. And any decision that you make, you have to live with, not them. So don't let anybody in this unit make a decision that you're not comfortable with. And those words have stuck with me forever. And in this video, what I hope to do is really spark a thought process for everybody listening so that you can really think as to whether or not this is something you want to do. I'm not going to give you a position either way. It's up to you. You're the parent. But I hope to just get your wheels turning a little bit. So let's go ahead and dive into this. But before we do, I'm Dr. Nick Zarowski, and welcome to the channel. Be sure to subscribe and hit that notification bell. You got to hit the notification bell. Otherwise, you'll never get the alerts when new videos are released. And also, if you want to take control of your health naturally, go to www.drzee.tv. And before we even get started in this video, I'm going to ask a big favor of you. Smash that thumbs up button because I've got some good information for you here. I'm going to bring in lots of different data from different areas. Okay, let's dive into this article. First of all, the number one question was, does the vaccine work in adolescents? Yes, recently released data from Pfizer Biotech shows that the COVID-19 vaccine seems, this is funny, it seems to work very well in this age group. The COVID-19 vaccine was found to be 100% efficacious in preventing symptomatic COVID-19 in an ongoing clinical trial of children in the U.S. aged 12 to 15 adolescents made high levels of antibodies in response to the vaccine, and their immune response was just as strong as what has been seen in older teens and young adults 16 to 25 years of age. One of the things I'd love to know is, well, if they're making antibodies to the vaccine, is it okay if they just make antibodies to actually getting COVID itself? Because we already know that it's not very dangerous for a child. In fact, it's not dangerous at all. How do I know whether the vaccine is safe for my child? Ooh, that's a million-dollar question. So far, the COVID-19 vaccine appears to be safe. Oh my goodness, I love how certain they are with this language. It appears to be safe and well tolerated in adolescents. All of the COVID-19 vaccines authorized for use in the U.S. have undergone rigorous studies, but we don't want to assume that children are little adults. Here's the thing, is that is not true. They did not undergo rigorous studies. I'm going to start throwing fact checks out there. This is why it is so important to study these vaccines just as carefully in children before health authorities could recommend use. Ongoing studies will continue to follow vaccinated children closely, and robust safety monitoring will help rapidly identify rare or unexpected concerns if they emerge. So now that we know this wonderful information, I am going to bring your eyes over to this article right here. 13-year-old Michigan boy dies, and I'm from Michigan, so this actually happened, and it was a big deal. Of course, none of the news was talking about it, but it's a big deal. 13-year-old Michigan boy dies 3 days after second dose of Pfizer vaccine. Aunt says moral, ethical, health questions need to be answered. And then there's a tweet from the mom. A week ago today, my brother's 13-year-old son had his second COVID shot. Less than 3 days later, he died. Okay, so that's not the mother. That looks like the aunt. The initial autopsy results done Friday were that his heart was enlarged and there was some fluid surrounding it. He had no known health problems, was on no medications. So this is really interesting. I mean, a healthy kid right here, and all of a sudden, next thing you know, bam, he is getting the vaccine and he gets myocarditis, okay? Now, here's another interesting thing here, because, I mean, this is something, it's wildly underreported when people have negative reactions to these. It's actually pretty much just kind of like covered up and hidden. Now, in the Defender, the other thing that they had was many interesting articles just about the problems with the manufacturing around these vaccines and how nobody is willing to accept responsibility. As a matter of fact, I was talking to my wife the other day, and I said, you know what? Imagine if every workplace that said, well, vaccines are required here. Imagine if they were held liable for that statement. And if someone had a negative reaction, they could get sued. They'd shut their mouth real quick, wouldn't they? Imagine if any doctor who gave the vaccine was held liable for giving that vaccine. Well, he would do a real thorough history and do his due diligence before ever giving that vaccine, because I mean, he would just lose his license as soon as something negative happened. However, doctors aren't held liable, companies aren't held liable, governments aren't held liable, nobody's held liable for this. So one of the top reasons here that they said there is a problem with the vaccine is that the vaccine makers are immune from liability. I don't know if you know this, but this is a big problem in my book. If you are making something, you should be held responsible. If you're claiming that something is safe and effective and everything in between, then you should be held to your word. The only industry in the world that bears no liabilities for injuries or deaths resulting from their products are vaccine makers. As first established in 1986 with the National Childhood Vaccine Injury Act and reinforced by the Public Readiness and Emergency Preparedness Act, vaccine makers cannot be sued, even if they are shown to be negligent. Now, do you think that when they developed a vaccine in a year's time, when it normally takes like 3 to 7 years, do you think that there's a potential for them to be having a little bit of negligence in there, just a little bit? The COVID vaccine makers are allowed to create a one-size-all-fits product. I talk about this all the time and how dangerous this is, because the idea of blanketing a whole population with one thing is always dangerous. It doesn't matter what it is. If it's a medication, if it's a vitamin, if it's a supplement, if it's a food, it just is not something that should be done, especially when this is something that's being claimed to be following the science, okay? With no testing on subpopulations referring to people with specific health conditions, and yet they're unwilling to accept any responsibility for any adverse events or deaths their products cause. If a company is not willing to stand behind its products as safe, especially one rushed to market, I am not willing to take a chance on that product. No liability, no trust, and here's why. And then this is something too that I want to touch on briefly, because I've talked about this before. I've talked about how one of the saddest things I saw right off the bat when I saw the companies that were making these vaccines is that they are known crooks. My goodness, they've been sued billions and billions of dollars because they have hurt so many people, and they did it knowingly, all in the name of profit. So number 2 here on this list of problems with this whole situation, the vaccine, the checkered past of the vaccine companies. The 4 major companies who are making COVID vaccines are and have either never brought a vaccine to market before COVID, Moderna and Johnson & Johnson, are serial felons. Pfizer's been sued like, I think it was like nearly $5 billion since the year 2000 in all the negligence and literally crimes against humanity because they knew what they were doing and they did it anyway, testing products and vaccines on third world countries. And AstraZeneca, so serial felons, or are both. Johnson & Johnson, he's saying they're basically serial felons, and also they have never brought a vaccine to market. Moderna has been trying to modernize our RNA, thus the company name, for years, but had never successfully brought any product to market. How nice for a company to get a major cash infusion from the government to keep trying. In fact, all of these major makers have paid out tens of billions of dollars in damages for other products they have brought to market when they knew those products would cause injuries or death. And so if you really look at what's happened, it's just horrible, horrible, horrible. And you can I break this down in another video where I literally go through all the different lawsuits against these companies over the years. It's actually horrific. Now, I had said that they're basically legally protected. And I'm going to go over to Cornell University Law School because a lot of people don't understand this. This is actually written right into U.S. law. 42 U.S. Code 300 AA-22 Standards of Responsibility. No vaccine manufacturer shall be liable in a civil action for damages arising from the vaccine-related injury or death associated with the administration of the vaccine after October 1st, 1988. I'm going to move down this article a little bit to direct warnings. Okay, this is about as direct as it gets. No vaccine manufacturer shall be liable in a civil action for damages arising from a vaccine-related injury or death associated with the administration of the vaccine after October 1st, 1988, solely due to the manufacturer's failure to provide direct warning to the injured party or the injured party's legal representative of the potential dangers resulting in the administration of the vaccine manufactured by the manufacturer. Now, one of the things that people don't understand is that when you get these vaccines, you sign a paper, you're signing your life away. You're basically saying, like, anything that happens, I take full responsibility. That's a heck of a thing to do when you don't even know what's in it, for goodness sake. I mean, nobody knows what's in it. I mean, when you go and get this, the average person, when you go and get this vaccine, you don't know what the side effects are. You don't know what's in it. You don't know anything. You're just taking it on good faith. And can you believe that you're actually signing on the dotted line? I accept full responsibility, even if the company, isn't being honest, even if there's dangers they didn't look for, even if there's side effects nobody knows about. Hey, this is all on me. Well, it makes you think a little bit differently, especially when you're lining up your child for this, okay? So you really have to make sure that you're thinking about this very, very thoroughly. Now, I want to go back to the Scientific American article. I thought children were low risk. Do they still need to get the vaccine? Currently, children represent nearly 1/4 of all new reported weekly COVID-19 cases in the U.S. Okay, who cares? They're getting it. But are they all dying? While serious illness from COVID-19 is rare in children, it does occur. Thousands of children have been hospitalized and at least 351 children have died from COVID-19 in the U.S. Some children who get seriously ill from COVID-19 may have underlying health conditions, but not all. Vaccination will help protect children from developing serious illness. Once again, these are statements that cannot be scientifically proven. And the reason they can't be scientifically proven because you don't know what the negative outcome is to these kids getting it. So when you look at all the kids who have gotten COVID, you're talking 351 died, okay? And I wouldn't want my child to die. I wouldn't want your child to die. I don't want any child to die. But the reality is COVID is pretty nasty, and it essentially will go and take some lives. But it doesn't mean you can't just see that number and go, well, that's scary. I mean, that means that we just need to vaccinate everybody because that number's scary. Well, what's the outcome on the other side of this? I mean, we see kids dying from myocarditis. I mean, that's horrific, and there's tons and tons of kids who are reporting to the hospitals and having inflammation in the heart, especially young males in their teenage range. And so it's something that is wildly concerning, and it's wildly concerning that they're using this blanket approach, okay? If there's a medication on the market, one of the things about it is that we know that based off genetics, based off of certain conditions that are pre-existing, based off so many factors, there's a good part of the population who should never have that that medication, right? However, they're just blanketing everyone with this without even caring, without even looking, without paying attention. I mean, I have someone I take care of that is a doctor of pharmacology, and I asked them very specific details. What are the side effects? What's in it? What's it? All of they could not answer a single one. This is the guy who's supposed to be the gatekeeper, the girl who's supposed to be the gatekeeper of protecting you from getting something you shouldn't have. Doesn't even know. No clue. We were told to do it. It's my job. And so this is really crazy. And it's something that we have to think about. Like I said, at the end of the day, as a parent, you have to make that decision. You're responsible for that decision. You're going to sign on the dotted line saying, I take full responsibility, regardless of the negative side effects that come out of it. But also, the biggest thing is you have to live with that decision, okay? The 19-year-old boy from Michigan that died, the 13-year-old boy from Michigan that died, his father have to live with that decision. And unfortunately, I don't think that they were informed very well. And in fact, I know they wouldn't have been informed very well. And so we have to take this stuff seriously. We have to take all these different little pieces of the puzzle and make sure that we're making the best decision possible. We know that COVID-19 hardly even affects children. Why are we rushing with experimental shots that seem or appear, and I quote, to work? Okay, that's a little bit craziness. So you make a decision on your end. I mean, you can probably guess by the tone in my voice and by the information I presented here what my decision would be for my own children. However, when you look at these things right here, you have to realize that it's a very unbalanced conversation. Most parents don't hear this. Like, you're hearing it from me, and I'm giving you the other side of the story. Like I said, I think that everybody should make their own decision because you're a responsible adult and you have to live with those decisions, and it's your child. However, what I also think is that people are given a very unbalanced and disproportionate thought process and information ideology around this whole thing, and they don't know what's right and what's wrong. So I gave you the other side of the story. Now you make a decision for your child. Be sure to share this video with your friends, and also be sure to check out the other videos on my channel.